to that region, that to be known as a spleen 10 point. This is the ideal point to treat for all the blood related disorder. That's called as a ocean, Suhai. Suhai means is the ocean of the point. So I need not to apply here. Then from here spleen 10, 6 Chun proximal 3, 3, 6. 6 Chun proximal to this region, that is the Chi-men, that is the spleen 11 point. Spleen 11 point. Now the points are coming here. I'll show you how to locate. Now this is the pubic symphysis here. Please try to see. This is a very important locations, but it is a vulnerable region points, but still I'll try to show you. So this is the pubic symphysis region where the hairline is there. From here 3.5 Chun lateral, 3.5 Chun lateral from the pubic hairline. Then this point to be known as a Chung-men. Chung-men means is the spleen 12. Spleen 12. Then spleen 12, then spleen 13, the point is located here. So where the spleen 12 point is located, this region femoral artery, this region is the femoral vein, then here is the femoral artery, vein, and then nerve. Femoral nerve is located here. So remember, I'll repeat once again. So from here 3.5 Chun, you just come down. So 3 Chun lateral, from here 3 Chun lateral, femoral artery is existing, femoral vein is existing. But the point is located 3.5 Chun lateral. Right there is no arteries existing. So there safely you just apply this is the Chung-men. Then 0.7 Chun above from this point, that to be known as a spleen 13. That is Fushi. Chung-men, Fushi, Fuji. So there are the points are located here, but here the femoral nerve is existing. Due to that reason, you remember the problem is here femoral artery is not functioning properly. Due to that reason, the whole leg gets the problem. The varicose veins gets the problem. So therefore, the varicose veins problem you are treating here, but at the same time there is a blockage is here. The femoral artery having the problem, femoral vein is having the problem. To treat that, so appropriately varicose veins, you just activate from this side. There is no wrong. The problem is on this region. So once you release this one, then the popliteal nerve, the popliteal vein, the saphenous vein blockages, that is slowly will going to release. And also this need to be like this. Whenever the patient will be lying down in this position for some period of time, half an hour, 1 hour, 2 hours, 3 hours or the whole night, that is one way is good. So that means it's going to the heart. So the femoral vein, that means is the saphenous vein, it slightly open, that goes and connecting to the femoral vein, and then through that it goes to the inferior vena cava of the brain, the inferior vena cava of the heart, so that the blood goes to that level. Again it started getting the oxygenated blood after the purification. If that's through the heart, through the lung system. Do you know why LU9 is the vascular system? The blood purification to be taken place in the pulmonary system. That's the reason LU9 they told is the good point to treat for the all the blood vessel related disorders. So now you remember this is a vulnerable point, but you should not insert the needle directly by using 1 Chun needle is not advisable in this region. So therefore I recommend you don't use it. As a deeper level, half Chun needle can be used. Thank you.
Use 5 and 6, will that be sufficient for
5 and 6 is the safe. Otherwise, you just taper this region. You palpate like this. You palpate, this is totally safe. This is the padding method. This is called as a padding method. And this is as a tapping method. Right? Yes. You just activate like this, one or other way is really good. When you do like this, what happens? when you do like this, when you do on the heel, when you do on the toes, when you do on the entire foot region, this you are activating to the lower extremities. That need to be done because we are standing or we are sitting, we are not walking. Varicose veins patient need to walk minimum 30 to 40 minutes per day is advisable. But always the sedentary life of the people, they don't walk. That's the reason it causes much more problem. Now you just take out this slightly, you just take out, yeah, till maximum you just take this, yeah, this enough. Now we will see the Fuji. So now Chungmen, Fushi, Fuji, Daheng. So now from 1.3 chun below, we can apply 1.3 chun below. This is where exactly. So we'll try to find out the first spleen 15 point where exactly is located. Now I wanted to withdraw here. So draw the line. So from the nipple line, I just bring this. So this to be known as a spleen 15, right? Spleen 15, 3 plus 1, 4 chun lateral, 4 chun lateral. So therefore this is very important. This is not important. What is important? Line is important. So from here to here, how many chun? 4 chun. So you just apply the needle. Here is the Taheng half chun. You just give it to me. Yeah, better you just apply for her, sir. You just apply this is spleen 15. So now we applied spleen 15. So this is the very safe point. Further that can go deep. That is only half chun that can go further deep. So now this is spleen 15. Then 1.3 chun distal. 1.3 chun distal, that is spleen 14. Spleen 14 and then spleen 15. You remember this is also related to the intestine, the descending colon and sigmoid colon problem. The patient feels there is a hernia. Hernia means inguinal hernia. Related conditions you wanted to use. Hernia, the most important point to be known as a liver 1, dadun, shung disorders. That is liver 1 is the hernia point, but along with that you wanted to add up the inguinal hernia related condition, you can use the spleen 14 as well, right? Then now we will go to the upward direction. 3 chun proximal to this region. 3 chun proximal to this region is Fu I. Yes, spleen. Now coming points are really important point. I'll try to tell you. You just apply this point. Yes, 3 chun proximal, we applied the spleen 16 point. Now 17 points, 18 points. Now this is something is tricky points. Now where this point is located. So this is the 4th intercostal space. This is the 5th intercostal space. Then 2 chun lateral. From here 2 chun lateral, spleen 15, 16, 17. You remember, so this is specific point. I think apply somebody spleen 17 point. Where the spleen is accumulated. On the which ribs the spleen is located. Spleen intercostal ribs 9, 10, 11. Where is 9, 10, 11? This is the 4th, 5th, 6th, 7th, 8th, 9. 9, 10, 11. This region majorly spleen is connected, but indirectly this also connected. So therefore, the spleen is related to all the spleen related problem. Remember, this is the 37 different types of the spleen disorders. But all the types of the disorders of the spleen, you can use the Shidu. She do is the spleen 17 point is good point whenever there is a lymphatic system, drainage system or the metabolism, any spleen related problem, spleen pulse deficiency, that time you wanted to use the diabetes mellitus. On the right side you just use it, but on the left side spleen problem you can use successfully by using this particular point. Spleen 17 for all the spleen. Spleen problem is there. Which point you need to remember? Spleen 17. But by the way, it's not advisable to apply to all the, you cannot apply men and we cannot apply to the women. But however, in certain conditions, if possible, you just use it. This point is good to treat for the spleen malfunction conditions, can be treatable successfully by activating which point? She do. Spleen 17 point. You keep it in the mind. Any spleen problem, what we should use? All the muscular related problem, the muscle related problem, digestive related disorders can be treatable on the spleen 17 point. Then the spleen 18 point is located to Chun lateral. That's called as a Tian C. Tian. Tian means is the heaven. So heaven C point is located to Chun lateral to the center of the nipple on the fourth intercostal space. So where this point is located? This point. Please apply somebody. Spleen 18. Spleen 18. Spleen 18 is a good point. Now what conditions we can use it? All the breast related disorders, birate related problem, birates having the problem, they be, that is at 3 o'clock position, they do have the lump or cyst. Even that situation you can use this point is always is good. Now the spleen 18, then 19, 20.
So breast and which problem, sir?
Spleen 18 for the birates problem, that means is the any breast related disorders, the lump or the cyst or the birates, that means is any condition, lump or any swelling is there, or the underdeveloped breast or the overdeveloped breast, all the local related conditions we can use it. By the way, this also good point to treat for the cardiac related disorders as well, because the point is located on the cardiac system. Now further, there is on the third intercostal space, that's you can apply this is spleen 18. Then 19 is the, this is Siang, this is Tian C, this Siang, this is Surang. You just apply, there are the 2 points here. Yes, apply, Imran, yourself. You come like this, Imran, you just come like this.
1 minute.
You come. Yes. Yes. Okay. पकड़ो सखलेन तुम्हें.
सर ये लेडीज पे कैसे लगाएंगे सर पॉइंट्स देखो, ये तो सारे ब्रेस्ट पे आएंगे ना.
हाँ जी, तो मैंने बताया था ना सुबह में, तो उनको ऐसा सोना है, जब वो लेटेंगे हाथ नीचे नहीं रखेंगे, हाथ उनका ऊपर रहेगा. तो दिखाओ ना. हाँ, हाथ उनका जैसा लेटेंगे तो ऐसा लेटेंगे, हाथ ऊपर रहेगा. व्हेन दे आर अबडक्शन, ऐसा वो सोएंगे ना, तो फिर ये ब्रेस्ट पूरा ऊपर आएगा, तो फिर आपका प्रॉपर लोकेशन पता चल जाएगा. So in that way we just apply the points. 20th point, the last point is the दबाव. अभी ये पूरा lymphatic system का जितना भी याद रखिए, जो स्प्लीन मेरिडियन है lymphatic system पे काम करता है, और ये हार्ट का lymphatic system हो गया, ये ब्रेस्ट का lymphatic system हो गया, ये स्प्लीन का lymphatic system रेगुलेट करता है, ये आके लंग्स का lymphatic system, उसके ऊपर जाते हैं तो चुंगपो, उसके ऊपर जाते हैं तो LU1 आ जाता है. सो LU1 करीब में है, LU1 के नीचे स्प्लीन 20 है, तो फिर हम लोग लिम्फेटिक सिस्टम ऑफ द लंग्स कैन बी ट्रीटेबल बाय यूजिंग दिस पॉइंट. अभी लास्ट पॉइंट बट नॉट डेफिनेटली लीस्ट, ये कौन सा पॉइंट है? द ग्रेट पॉइंट, दैट इज द तपाव, मदर ऑफ. गुड, वेरी गुड. सो आपने यहाँ पे एक्सिला, आप देखिए एक्सिला है, एक्सिला के नीचे वर्टिकली बिलो द एक्सिला द रीजन यू कम डाउन, तो उसके नीचे आप डायरेक्टली आइए. ये फोर्थ इंटरकोस्टल स्पेस हो गया, ये फिफ्थ इंटरकोस्टल स्पेस, ये सिक्स्थ इंटरकोस्टल स्पेस. एक्चुअली ये दोनों रीजन ये दबाव पॉइंट है स्प्लीन 21. स्प्लीन 21 आप दीजिए. सो आई जस्ट अप्लाई दिस पॉइंट. अगर आपने दोनों रीजन पे कर सकते हैं, अगर ये पॉइंट भी लगा दो, फिर आप निकाल दो, फिर ये पॉइंट भी लगा दो। फिर आपने स्प्लीन 21 नो सर्टेन ऑथर्स हैज रिटन इन द 2 डिफरेंट लोकेशंस। उन्होंने 6 इंटरकोस्टल स्पेस में लिखा है, कोई ऑथर ने 7th इंटरकोस्टल स्पेस पे लिखा है। तो फिर दोनों पॉइंट हम मानते हैं कि वो अच्छा पॉइंट है और स्पेशली ट्रीटेबल फॉर व्हाट कंडीशन। जितना भी होल बॉडी पेन होता है ऐसे सिचुएशन में भी हम लोग इस बिंदु को लगा सकते हैं। अगर होल बॉडी पेन या फिर द बॉडी सिस्टम कंफ्यूज हो गया है, पता नहीं चल रहा है कि प्रॉब्लम क्या है और कहाँ पे है, तो ऐसे सिचुएशन में हम लोगों को कोई मास्टर पॉइंट लगाना है। मैंने मास्टर पॉइंट 5 पॉइंट पे मास्टर पॉइंट्स मैंने बताए। एक है आपका, एक पेरिकार्डियम 5 चियांशी, दूसरा सैंजो 8 सन्यांगलाओ, और दूसरा सनिंजियो स्प्लीन 6, तीसरा आपको चौथा जीबी 39, और 5th पॉइंट मैंने कहा और स्प्लीन 21। ये 5 पॉइंट हैं, पूरे बॉडी को रेगुलेट करते हैं। ओनली 5 पॉइंट्स, इट रेगुलेट्स टू द एंटायर बॉडी। 5 पॉइंट्स टुगेदर। हाँ, अपने एक बार चेक कर लेना, मैंने एक वीडियो भी अपलोड कर दिया 5 मास्टर पॉइंट्स, तो फिर वो इसके बारे में मैंने डीप thoroughly बताया हूँ। ये स्प्लीन 21 and then spleen 6 and then GB 39 and Sangio 8 and then pericardium 5, वो पूरे पॉइंट्स जंक्शन पॉइंट्स होते हैं। So this is the mother for all the collaterals. Spleen 21 is the mother for the all the collaterals, मतलब 16 collaterals हमारे शरीर में हैं। ये collateral इंक्सियांग, यानी मैंने स्टमक 16 भी एक कोलैटरल है, लेकिन दूसरा पॉइंट हमने बता दिया कि ये मतलब 15 + 1 16 कोलैटरल्स यानी लुवो कनेक्टिंग पॉइंट होते हैं। उसका मदर है दबाव, दैट इज maybe we'll ask you in examination, you write down the which meridian having the 2 luvo connecting points. So 2 luvo connecting point एक ही मेरिडियन में है, वो स्प्लीन है। एक स्प्लीन 4 कर दिए, स्प्लीन 4, और सेकेंड आके स्प्लीन 21। So this is the major luvo connecting point कौन सा है? स्प्लीन 21। माइनर luvo connecting point कौन सा है? और स्प्लीन 4 है। So sunlu, sulu, fulu, there are the 3 sunlu, sulu, fulu करके 3 लुवो कनेक्टिंग पॉइंट्स होते हैं। तो भी फिर हम लोग जब भी मेरिडियन में दूसरा पॉइंट्स बोलता हूँ तब मैं बताऊंगा कौन सा है, फूलो, सोलो, सिनलो। ये collateral is nothing but is communicating to the interior and exterior in between the 2 organs. That means the husband and wife meeting point to be known as a collateral. For example, LU5, LU7. LU7 is the meeting point to connect to the large intestine and then lungs. LU7 is the lung point.
It's same as luvo connecting.
Yes, luvo connecting point is nothing but is the collateral point.